Hi everyone, and welcome to session one, which is the introductory session for the Associate Continuing Healthcare Practitioner. My name is Stephen Davis. I'm going to be your lead lecturer throughout this standard. So let's just dive straight in. This is a level 5 standard. So it's equivalent to a foundation degree or second year at university. It potentially is going to take between 18 and 24 months for you to go through the process and learn the roles and responsibilities. So let's just have an overview of what the standard is, then we'll explain about the EPA, and then we'll look at the teaching and learning materials. So the overview for this role is about planning and commissioning care for people with complex health and social care needs. Now, I know most of you have got an understanding of this within health and social care because it's not an unfamiliar thing, but it's relatively new for health and social care staff to be involved with this. So it's quite a new standard. Ultimately, it came around because the clinical commissioning groups and social services looked at the continuing healthcare service, and they provide care for over 60,000 people over the age of 18. And there's an annual cost to England, which is around 70% are in nursing homes and only 30% are in their own homes. So there's a large proportion of associate continuing healthcare being placed in residential nursing homes, with only 30% in domiciliary. I would argue that that's because a lot of people in their own homes just don't access or can't access this. Who knows? The broad purpose of this standard, or to be part of the continuing healthcare team, is to provide packages of ongoing care that are agreed and funded solely by the NHS. So this is this extended piece around healthcare. The Associate Continuing Healthcare Practitioner plays a key role in assessments for complex health and social care. And as a result of this, you'll be involved in carrying out assessments and writing those reports. In your daily work, you'll be working alongside family, carers, multidisciplinary teams, and you'll be able to refer for continuing healthcare services. Again, you'll be part of that team reviewing, you'll be able to look at those care packages that are coming in, and then you'll be able to weigh up whether or not you've got the right financial support. So ultimately, this is a real fundamental role because unless you're able to assess people's needs properly, be able to care plan on a holistic outcome-based or strength-based approach, and have a good idea of physical health and mental health well-being, it's not surprising why most continuing healthcare funding claims are rejected, because there's such a poor understanding of the criteria and the paperwork and the frameworks involved for doing them. So the entrance requirements for this kind of sit with the employers, but we would expect the apprentice to have at least 2 years experience within health and social care, or at least have been working directly with the continuing healthcare team. Now, this standard has 10 duties. There's lots of skills, knowledge and behaviours. We'll explain those shortly, but we'll look at the duties first. So what I'm going to do is I'm going to share my screen so you can have a look at these. We are on the Institute for Apprenticeships website. If you put in Associate Continuing Healthcare Practitioner in the search bar, this will come up. And as you come down, you've got your duties here on the left-hand side and the skills, knowledge, behaviours on the right. So the way in which we're going to run this, we generally do one duty every 2 months. We do knowledge, then we do skills, and then you do your assessments for each month. So it's roughly 2 months of duty. So in duty 1, you're going to undertake, manage and review individual care packages, ensuring it continues to meet their agreed health and social care needs. Relatively straightforward here. You need to be able to assess somebody using evidence-based assessment tools, come up with the right nursing interventions or care interventions, and have a clear understanding about their physical health and mental health well-being, as well as working as a multidisciplinary team. And when we see that array of knowledge requirements, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 12, 13, 17, 19, 21, 22, 25, 27, 29, if we click on there, it will take us down to what those are. So again, straight away, look, understanding the functions of the human body. So understanding anatomy and physiology, so you understand what's wrong with somebody. And again, for that anatomy and physiology, we need to understand what the right anatomy and physiology is, and then we need to understand the altered physiology. So understanding what it looks like when something goes wrong. But we'll break that down as we go through each class, so don't worry about that. Duty 2 looks at contributing to planning for the individual's care plan, ensuring it meets the agreed health and social care needs. So that's contributing to care planning. Duty 3, you're going to contribute to the continuing healthcare assessment. So that's looking at the mandated tools or the mandatory tools outlined in the National Framework for NHS Continuing Healthcare and NHS funded nursing care. So the government have got a set of their tools, they have their pathway tools, they have their assessment tools, the guidance and the frameworks, but there are other organisations and charities out there which we look at that can help complete these. Number 4 looks at supervising staff assigned accordance to organisational policies and procedures, so making sure that staff are following the agreed care plans, to making sure that everything's working right there. Number 5, manage continuing healthcare referral process. So again, there's 2 processes there. There's that end of life pathway, so that's the fast track service, and then there's the normal one. So again, just making sure that you're aware of the 2 and know how to apply for those and claim for those. Number 6, we're going to collate and analyse evidence assessment documentation. So looking at each of the criteria, understanding the evidence that's required to support what you're saying, or look at the assessment tools in which you're going to do, and to make sure that the individuals are eligible lawfully for the decision that's being made. So making sure that actually, if you are going to claim for somebody, you've got the evidence there to do it. So we're not wasting time. 7 looks at the coordination of the multidisciplinary team, so working alongside the doctors, the physios, the district nurses to help contribute towards that and making recommendations for the continuing healthcare eligibility. Number 8 looks at the contribution to resolutions. So again, the right to appeal. Dare I say, there definitely seems a lot more rejections than exceptions, but I'm not surprised. We are living in a cost of living crisis with lots of cutbacks. So again, making sure that the decisions are fair and equitable, that actually you have the right to appeal in a legal manner. So again, understanding that appeal process. Number 9 looks at the contribution to the Commission of Services, so meeting the individual's health needs, so looking at multidisciplinary team working, looking at those referral pathways, which I know you guys do all the time. And then finally, looking at monitoring the continuing healthcare provided service, so looking at a personal healthcare budget, and obviously looking at the procurements for that and local arrangements. So quite an interesting set of duties to really help underpin claiming this additional funding that people could be entitled to, where a lot of the time homes or services just aren't claiming it. Again, I'm not going to run through all of these knowledges and skills, but there are quite a few here. But again, we're going to run through them on a weekly basis. So as we're doing the teach and learn, we're going to be touching on these all the time. Remember, the endpoint assessment will only cover the knowledge, skills and behaviours that you learn here. So if it's not in here, you're not going to have to worry about it. So K1 is understand the structure and the functions of the human body. So that's anatomy and physiology. This unit is always, or this module is always a big one. It really is the one that terrifies people the most. You don't need to worry about it. We do cover it. We cover it a lot in the CHAPS program, which is the care home assistant practitioner, which is the bolt-on module, which we do with this. So you're going to naturally cover that. So you'll cover that through things like when you do vital signs, we look at the organs and the structure of the body, through to basic life support and all that stuff. So again, it's embedded through the teaching and learning. We just give it to you on the systems structure. So we don't necessarily go deep dive into this on this level. It's more about just what the organs do and what happens if they fail, and what kind of support do people need when that happens. Again, understand how to support people going through the continuing healthcare process. This it's a government system, right? It can be quite complex, it can be difficult. So there are easy reading tools online. You need to give people the advice and guidance. You need to make sure that family and advocates are all up to date. So just understanding that. Understand mental health, physical health, cognitive conditions, the medication used in the treatments. I mean, it's such a wide learning outcome, that one. So again, understanding health and mental health, common conditions, infection control. So principles of infection control is obviously really important. Understanding the principles of funded care and joint packages. So understanding how funding works, how it's brought together. But again, that is that's in the documents from the national government website. So when you log in, it's already built into the assessment task for you to download those and start to have a look at them. And as we run through things like communication, using personal budgets, principles of healthcare business and financing, core morbidities, undertaking risk assessments, using a range of assessment tools, looking at quality assurance, understanding factors around vulnerability, understand the functions of the CQC. It's all there, right? We then look at the skills. So under the skills, it's about making the right referrals. It's about formulating the care plans. It's about making sure we're screening properly. It's about making sure we're planning routine assessments and referrals, that we're protecting people's health through applying principles of universal infection control procedures. So your normal COVID stuff there, everyone knows this now. Using accessible information, so the AIS standards, and using digital ways of managing that now. So, you know, if we're using ChatGPT, we can put things in dementia and easy read formats, and the computer now generates it. So it's so much easier for us. Looking at report writing skills, report writing is an absolute skill, and that's why some of the assessment tasks in this is we make you do it a couple of times, because it's quality, not quantity. It's evidence-based writing, being concise, being factual. Again, if you were thinking about SABAR, situation, assessment, background, recommendations, lots of things there to think about. Facilitate those discussions, so making sure that people are involved, so we're networking correctly. Identify the responsibilities of commissioners, to understand what local authorities are doing, or local foundations are doing, or local CCGs, and all of this stuff. Prioritising people based on level of risk. So when you do the assessments, you're grading them properly with the right evidence there. You're doing the referrals in a timely manner. You're seeking a range of support there. Again, recognising risks, things around neglect. Commissioning safe, effective, person-centred care. So making sure that when you do assign this, you've got the right team and skills and expertise to deliver it. Work within your own levels of competency. So ensuring that you're aware of your scope of practice. Being an advocate for that individual. So like I said, there are charities and organisations that you could refer on to. And refer on is an absolute skill in itself. So just knowing when to say to somebody, look, I think you're going to get more support if I referred you on. Acting in accordance with legislation, so understanding the laws and the policies. There are lots of things there. Range of digital technology. So again, we're doing that digital series. So if you're not sure, start watching that digital skills that I'm putting out there as well. That'll be in your announcement bar under the induction. And then finally, you've got your behaviours. Now, your behaviours I don't expect you to be doing this one at a time. I expect you to be doing this all of the time in everything that you do, because your behaviours are the way that you should be working. So here you can see acting in a non-discriminatory way. Well, it's a given, right? You should always be doing that. Be caring, sensitive, and compassion. Well, that's your 6 C's, so we should be doing that. Have courage in speaking up and challenging on concerns. So again, most of the people that I come across do not have a problem advocating, but it can be challenging when you get a report that says no, and you need to advocate and fight for a yes. So that can be quite a challenge. You know, you have to be adaptable in this role. You've got to show resilience. You've got to show that self-awareness. You have to demonstrate effective leadership at this level. Because ultimately, if you can't lead yourself, if you can't advocate, really, is this the right role for you? You need to communicate in a sensitive way. You're going to be handling lots of sensitive data, potentially, you know, end-of-life information on the care that somebody's going to receive towards their end-of-life stages. So making sure that you can manage all of that. And that's the emotional, psychological, again, being mindful of the language, etc. Building those relationships along the way of working, act as an ambassador to promote trust and demonstrate accountability. So lots of high-level behaviours there to be an associate continuing healthcare practitioner. Now, once you've covered all of those standards and you've gone through the online learning material, and we basically get you to a point called Gateway. And once we're at this point called Gateway, you'll get there as the program comes to an end. We'll make sure you're happy with everything that you've learned, your skills, your knowledge and behaviours, and we then put you forward for your endpoint assessment. What happens at this, you can see here, you need to have your English and Maths at level 2 ready. And you'll need to have your portfolio of evidence in which we've prepared. So that's all of the work that you're submitting through the Associate Continuing Healthcare Practitioner side. Now, when we go through to Gateway, it's to prepare you for the assessment plan. Now, we'll bring the assessment plan up and we'll talk about that. So your endpoint assessment consists of a professional discussion based upon the evidence from which we upload. And normally what happens at the end of the standards here, we've got the professional discussion here, and it basically says, look, oh, that's the observation. So the professional discussion basically goes, look, this is what we're going to discuss. That's the criteria in which we're discussing it. So you can kind of understand what a pass mark is and what a distinction mark is based upon the evidence in which we're going to be uploading. So they're only going to talk about whatever it is we've uploaded. So it's not going to be a surprise for you. You're going to know the evidence in which we're submitting because it's the evidence in which you've presented to us that we've marked and said, yes, this is absolutely fine. And again, you should then be able to do that professional discussion quite happily. The other one is then an observation and question. So this is where you are observed contributing towards the Associate Continuing Healthcare Assessment. And again, in there, it lists the stuff in which is going to be covered during that observation. So you get to plan this. You'll be observed contributing towards the continuing healthcare assessment. So in other words, you need to prepare this with the EPAO, the Endpoint Assessment Organisation. It'll be 2 hours and 30 minutes. The observation will be 2 hours, 30 minutes for questioning. And again, the observer is going to be seeing how you work in line with the policies and the multidisciplinary team when working towards the Associate Continuing Healthcare Assessment. So again, you'll have done this. By the time you get round to here, you'll have done a couple, you'll know exactly what you're doing. So there's nothing to worry about there. Now, let's look at the portfolio. So as you log in, you've got your portfolio here. In section 1, under here, you've got your welcome. This is your just basic induction. That's absolutely fine. You click on there and work your way through it. The knowledge, skills, and behaviours there, these are PowerPoints in which we are going to cover as we go through the duties. So as we go through duty 1, for example, and it says under the functions of the human body, we'll cover that PowerPoint and we'll do that session. So you don't need to worry about that. What will happen is the recordings will then be uploaded here. So in my side, there's a button that says live recordings. They'll be there so you can watch those. So if reading isn't your thing, yeah, you can watch those to help you. You'll go through this, and like I said, everything that you need is here. So for example, in month 1, we talked about the nursing assessments, we talked about anatomy and physiology, and here they are. So look, this is how to carry out a nursing assessment, and here's your anatomy and physiology. The anatomy and physiology is a large component. You don't have to get it all completed in that month because it is a big component. That's why we've put it at the beginning, just so you've got time to work through. Now, as you click through, you must make sure that you click through everything. So what I mean by that is when you click on here, we'll wait for that page to load. So look, you've got your PowerPoint presentations there. Look, undertake measurements, review terms for the care package, ensuring complete the needs. It's 122 slides. It's quite a big PowerPoint, that one. You can run through that. You've got your case studies and stuff. That covers all of that. But all you're going to do is you're just going to click through. What will then happen? You'll get to your first assessment. And your first assessment there, you can see, is you've got 35 questions to answer. So you just take the quiz, do the questions, multiple choice. So there you go. Which of the following is responsible for pumping blood through the body? Heart, liver, lungs, kidneys. So it refers to K1. Okay, so nothing too difficult there. You'll do those questions, that's fine, and then you'll go into your case studies. So case studies then, here are the case studies. You're going to read the case study, go through the care plan. Oh, let's go back. Why didn't that work? It's because it's not been unlocked yet. Right, and that's because when it says that, basically, it's because we haven't clicked through it. So what we have to do for it to work, we just have to click through next. And then as we go through, so we're reading. Bear with me. So normally, if it says the exam hasn't been unlocked, they have all been unlocked. It means you haven't clicked through all the pages. So the system is set up that you have to click through the pages before you can take the assessment, which basically means you should have read it before you take the assessment. So that's where we're at. So hopefully we should be nearly there. There we go. That was the multiple choice test. So that's that one. We'll move into month 3. Almost there, so don't worry. Nearly there. Bear with me. Bear with me. There we go. So here you can see you've got Mrs. Jones. She's an 82-year-old woman who has recently been discharged from hospital. She had a fall, broken her hip. She now requires ongoing care for recovery to prevent further complications. As a care manager, you are responsible for reviewing Mrs. Jones' care package to ensure it continues to meet the agreed healthcare needs. What steps would you take to review Mrs. Jones' care package? So here you hit new attempt and you write your answer there. So that's how it works. So here, what we're interested in is going, well, okay, so she's had a fall, her left hip is broken, so physiotherapy, what adaptation of the equipment is there? Has she got hip protectors? Has she got sensory mats? Has she got OT? Then we're going to ask ourselves, well, why did she fall in the first place? You know, does she need a medication review? Was she on blood thinners? Has she got dementia, early onset stuff? So again, you're going to think about all of this stuff in your review, and then you're going to put together the care plan. So you then just say, look, this is what I would do. So for example, for me to accept Mrs. Jones home, I would want to have an OT referral. I would want to make sure that I've got the falls prevention teams in place. I would want to make sure that I've had maybe a trusted assessor out to do equipment and adaptations. Maybe I'm going to do the assessments for mobility myself. So I'm going to do my own risks to fall. I'm going to do my own moving and handling. How is she going to get her food and nutrition? So all of this stuff, what medication do I need a doctor's review? So all of this stuff is what we're going to put in. Then you hit submit, and then you just move on. And that's really how the system works. So we're going to go through that. Now, what happens is, as you submit stuff, you'll see your grades. So your grades comes on a grade report. So here you can see this is work that's been previously marked. So that's great. So again, any feedback and stuff, you'll see it comes up here. People are the people in your group. Files will be anything that we upload. So look, there's your professional discussion pad. So you're ready for that. PowerPoints that we've added, course books, etc. Syllabus is just an outline of all of the units, the assessments of what's going on, etc. And then your modules is pretty much back to your home page. You've got your inbox there, which is your emails, so you're able to communicate with us back and forth. And again, here, look, if there's anything for you to do or read, it's here. So here we just talk about the sessions, etc. So lots of things for you to be looking at and doing. Now, what's the important thing here? I'm just going to show you this as an example because I want to show you anyone that's a learner in your group. But if we click on a learner, this is what I can see on my side. So I can see your overall grades, but equally I can see your access report. So I can see when you logged in and how long you logged in for and how many times you've logged in. So it's really important that you log in on a regular basis so I can make sure that you are doing what you're meant to be doing, because obviously we have to make sure that you're doing at least 6 to 7 hours a week of logging in. So please make sure that you do. Equally, any discussions or anything like that will appear in here. So again, if I log in, there you go. So there's the recording. So today's recording will be in there. And you've got some reading books coming, but any discussions will appear there on the discussion boards as well. So that's everything for now. That's your induction. It is a helicopter tour, just a bit of an overview. So you've seen the standards, you understand what's going on, you've seen the online material, you know where all your teaching and learning materials are. And again, we'll be popping videos in on a weekly basis to help you through the course material. So if you need anything, there is the email button here, so you can send me an email, or alternatively, just feel free to send me a WhatsApp and I'll always respond. So I wish you all the best of luck and I'll see you in the near future. Take care, guys. Bye for now.